University of Pittsburgh, Professor Ernesto.
Oh boy.
So, what about now? Let me see.
Yes, better.
Michele,
Yes.
alguma novidade? Tá ouvindo, Michele?
Yes, now it started the sound.
Ok, thank you.
It's working.
Okay, Ernesto, are you
Agora
still there?
sim. Yes.
Okay.
So let's begin
Better?
again.
Yeah.
Starting now, people, okay?
Now you're hearing. Yes. Okay.
So, hi everyone, good afternoon, welcome. This is the first symposium, Representations of Public Health. My name is Cristina de Campos. I am the coordinator of this project. I would like to thank the colleagues who helped with the realization of this event, especially those who will present their contributions in the 2 days of the event, Professors Donald Burke, André Mota, and Maria Alice Ribeiro. Welcome, and I hope that this symposium will be a great start to an incredible project. Jefferson, please. Jefferson, you are mute.
First of all, I would like to ask the participants to turn off the microphone, please. Dear colleagues and participants, good afternoon. I am Jefferson Sashi, historian and PhD in Science and Technology Policy at Unicamp, and today I will coordinate the presentation of the symposium, Representations of Public Health, Global and Local Perspectives on Geraldo, Horácio, Paula, Souza's contribution for public health. Furthermore, Michelle Diaz is on YouTube, coordinating the messages and the interaction with the public as well. Firstly, I would like to invite Professor Marco Sinésio Monteiro, coordinator of postgraduate program of Science and Technology Policy, Institute of Geoscience, Implementation Results of Campina. Thirdly, I would like to invite Professor Guilherme Vasco Ramos from São Judas Tadeu University for his contribution. Professor Marco, please, you can start whatever you want.
Thank you, Jefferson. Wanted to welcome everybody. Thank you, Cristina, for putting this together. Very complex to bring all these folks here, but it's one of the few advantages of this situation that we can interact virtually. Welcome everybody here and welcome everybody on YouTube. I'm going to apologize beforehand because I'm going to have to leave. There's a meeting I have to attend that I could not get away from, so I will miss the discussions today. I hope to be here tomorrow, participate. It's a pleasure to be a part of this project with Cristina, with Dr. Marinho, Dr. Andre Mota, Jefferson, Michelle, everybody else who's involved. Great pleasure to have Dr. Burke with us. Probably this is going to be said many times today. It's very, very timely project in terms of what we're living today. The role of the WHO, and especially I think the place for any kind of global governance of health and global governance of health technologies is very much on the agenda today. I was fortunate to be in an event where the head of the WHO talked about COVID, and so I think never before in our lives we have been so much aware of these global bodies, and at the same time we have this very bizarre, very violent backlash against global organizations, global multilateral agreements in many countries, not just in Brazil. Brazil is an especially bizarre example of what's happening. So I think this event and events like this and projects like this will have a great contribution in terms of investigating, reflecting on the history of these institutions, how they emerged, how they came to be, and the importance that the positive role that these global governance frameworks have had in building resilience, building ways to survive through something like a pandemic, the COVID pandemic. So I'm very excited to be a part of this project with Cristina, with my colleagues. I wish you all a great event, and I hope to be here more present tomorrow. So sorry, Cristina, Dr. Burke, everybody, Dr. Marinho, everybody. I'm going to have to leave, but I wish you all a great event, a great debate, and thank you so much for having me.
Thank you.
Thanks, Dr. Marco, for your participation. And then I invite Dr. Fernando Vasquez from Rockefeller University for his contribution with us. Please, Dr. Vasquez, whenever you want.
Thank you very much. My name is Fernando Vasquez Ramos. I am the coordinator of the program of postgraduation in architecture and urbanism of the Universidad San Judas Tadeo. We are pleased to open this first symposium, representation of public health, the global and the local, in the contribution of Geraldo, Horácio, de Paula, Souza to public health, an event that marks the first year of the research project coordinated by Professor Cristina de Campos and financed by the FAPESP, on the set of photographs taken by Horácio de Paula Souza at the beginning of the last century, an iconographic material of great historical importance and public health in Brazil and in the world, or at least in the United States. Thinking on the global and local scales. Also an important reflection on philanthropic actions on the Rockefeller Foundation. The program I represent can only thank the participation of the participants, FAPESP, for their support, and Professor Cristina de Campos for the initiative. I wish you all a good event, and we thank you for your participation. We will be welcome to Brazil and to our university. Thank you very much.
Thank you, Professor.
Thank you, Professor. Then, continuing our symposium, I would like to call Professor Cristina de Campos, as well as Steve, who was my tutor at the master's and PhD. Professor Cristina de Campos from the Department of Science and Technology Policy, Institute of Geosciences, the State University of Campinas, and from Rockefeller University. We will present a communication titled Representations of North American Public Health, Project Year 1, Accomplishments and Challenges in a Time of Pandemic. Please start when Ms. Kennedy.
Thank you, Jefferson. Well, good afternoon. I appreciate everyone's presence. I will make a brief assessment on the first year of the project. The project, with its title Representations of Public Health in the United States, works with the organization of a part of the material that belonged to the Professor Geraldo Paula Souza. The project works with the documentation for the period he was in the United States doing his PhD in Hygiene and Public Health at Johns Hopkins University. While in the United States, Paula Souza produced an expressive documentation divided into photographs, letters, and postcards. But who is Geraldo Paula Souza? Geraldo is this little guy here. His father, Antônio Francisco de Paula Souza, the first dean of the Polytechnical School of São Paulo, He grew up in a traditional family in São Paulo. He's professor in the Hygiene Institute, São Paulo, fellowship from Rockefeller Foundation, director of sanitary service, first dean, Faculdade de Saúde Pública, and proposed the creation of a global health agency. This precious collection was with the family of continue my research on Geraldo Paula Souza. Initially, we would work only with the photographs, but we decided to include the other materials because they help in understanding the photographs. The objectives of the project are two. The first one, analyze the photographic material produced by the Professor Paula Souza and understand the motivation for the formation of the collection. And the second one, to create a catalog with the photographs, which involves the digitalization and the creation of a catalographic forms for each photograph. To meet the first objective, the second is fundamental and justifies starting the project by organizing the photographs and cataloging them. The team is currently dedicated to the organization of the catalographic forms of each photograph. The proposal is funded by FAPESP, the São Paulo Research Foundation. The project team consists of 3 researchers, me, Professor Marco, and Professor Gabriela Marinho, and a technical training scholarship, Bruno Soares. We also have the following collaborators of the project: Jefferson Sanchez, Robson Simões, and Barbara Vicalvi. The project was approved last year, shortly after restrictive measures were adopted by the state government due to the pandemic. We chose to continue the project following the protocol set by the state and the municipal authorities, and above all, respecting the restrictions of social contact. All meetings relating to the project were remote, using the Google Meet platform. The selection process for hiring scholarship holders were done remotely as well. In January 2021, Bruno Henrique Soares, who is a historian, joined the project. We are in process of hiring 2 more technical training students undergraduate level to assist in the preparation of the forms. On the other hand, the project planned for the approximation with institutions that would assist us in the digitalization process, as well as the training of our students in techniques of conservation and the archiving of photographic materials, which unfortunately was not possible. We study manuals and other documents issued by official agents for the handling and conservation of photographic material. In addition to the literature on working with the catalographic forms. For the organization of the photographic collection, the works of Lima de Carvalho, Fotografia e Cidade, and the Felipe Lima Carvalho, Como Tratar Coleções Fotográficas. The authors are referencing archival and historiographic studies on the management of photographic collections. Lima and Carvalho are responsible for the photographic sector of the Museu Paulista of the University of São Paulo. The actions thought of in the project take as reference the indications postulated by the authors. The authors emphasize that one of the first actions should be the realization of diagnosis of the collection. We did not know for sure the exact number of photographs in the collection. We started the process of scanning the negatives in low resolution for remote work. It was necessary to build a device for scanning the negatives, as well as buying equipment such as a tripod and a LED ring, adapting in times of pandemic. We also constructed a backlit device for scanning negatives. It is basically a box with a light source inside and a small opening. Here. Can you see that? A small opening in the top where the negatives are placed. The camera used is the cell phone supported by a tripod for stability. So, as a result, we obtained the exact number of the material worked. 563 negatives, 454 on paper. The next step of the work is to enter a location number for each photograph, identify series very common in the collection. Now I show you a small sample of the photographs. The first one, the series that shows the Cardinal Gibbons visiting Baltimore. This is the type of photos in the collection. We can observe that there are notes on the sides made by Geraldo. Here. The photos are not professional quality, as Geraldo was an amateur photographer. The photos are for his mother, who was a very religious person. Water and the sewage treatment plants. These photos were for himself, representing his area of interest. Also note the captions in Portuguese used here in Brazil. And the series about Atlantic City. It was a sightseeing tour in Atlantic City, noted the notes of Geraldo in the pictures. We will create a catalographic form for each photograph, according to the indications of Lima de Carvalho. You can see here. The prototype of the form for the photographs with the items to be filled, register technical specifications, and an example of a filled form. We can see here the Photo number 37. And the informations, okay? Publications and the descriptors, and compiler date was Bruno Soares. We emphasize that a description of the photographs will not be made. We will use iconic descriptors instead of the textual description of the scenes represented in each photograph. Descriptors allow the use of research tools. The formal descriptors, identification of photographic techniques and materials, require a technician specializing in photography, which we will solve later. Another important field of the forms, inclusion of the other documents that allow us to understand the realization of the photographs. In this case, it is the letters written by Geraldo Paula Souza to his family members. Many of the letters have detailed accounts of the photographs. The inclusion of other documents was not provided for in the initial work plan. The first year of the project revealed considerable amount of work, indicating the need for a few more years to work for the material to be made available to the general public. We are working hard. We hope to soon bring to the public at events like this the results of work. Thank you very much. And I stop here. Jefferson?
Thank you, Chris, for your presentation. Then, when ending the event, I would like to invite Professor Donald Burke, Dr. Burke, from University of Pittsburgh for his lecture, Formation of the World Health Organization, Geraldo Paula Souza contribution. But before his presentation, I would like to make a quick introduction of Professor Burke and his career. Dr. Donald S. Burke is a distinguished university professor of health science and policy and former dean of the Graduate School of Public Health at the University of Pittsburgh. A native of Cleveland, Ohio, Dr. Burke received his PA from Western Reserve University and his MD from Harvard Medical School. He was an intern and resident in medicine at Boston City and Massachusetts General Hospital and trained as a research fellow in infectious disease at the Walter Reed Army Medical Center. He has studied prevention and control of infectious disease of global concern, including HIV, AIDS, influenza, Japanese encephalitis, dengue, and emerging infectious disease. He has lived 6 years in Thailand, worked extensively in Cameroon, and conducted collaborative vaccine and epidemiology studies in India, China, South Africa, and other countries. He served 23 years as an active duty officer at the Walter Reed Army Institute of Research, retiring at the rank of colonel. He then served 9 years as a professor at the Johns Hopkins University School of Public Health. He joined the University of Pittsburgh in 2006, where as dean he founded the Pittsburgh Health Dynamics Laboratory, an academic team that develops computational models and simulations of accidental infectious diseases, substance use disorders, and other dynamic public health problems, and use these simulations to evaluate prevention and control strategies. He has been on the board of health of Allegheny County, Pittsburgh, for 11 years. Dr. Burke has authored or co-authored more than 300 publications on public health and medicine. He's fellow of the American Association for Advancement of Science, a fellow of the Infectious Diseases Society of America, a past president of the American Society for Tropical Diseases and Hygiene, and elected member of the National Academy of Medicine. Dr. Burke is the founding president and board chairman of FAPESP Incorporation, a startup company that develops computational modeling software solutions for epidemics, diseases, and other complex social problems. Professor Burke, it's a pleasure to be with us, and I invite you to start wherever you want.
Thank you very much, Jefferson. Cristina, how much time will I have? When should I plan to finish?
Professor, it's free.
Okay.
Take your time, okay?
Good. Well, thank you for that. Let's see. I'll present my screen. Do you see that?
Not yet, Professor.
Okay. Present now and share. And now I need to do this.
Yes, Professor. I can see.
How is that?
It's okay, Professor.
Okay, let me blow it up for the whole screen. Does that now go for the whole screen?
Yes, Professor.
Okay, thank you again for this interesting symposium. I'll be talking about the formation of the World Health Organization, and particularly my interest in the WHO definition of health, and emphasizing Geraldo Souza's contributions. In English, the WHO definition of health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And this preamble to the Constitution was adopted at an international health conference in 1946. Then that conference was chaired by Thomas Perrin. And I want to spend some time discussing how this definition came into being, because it is used all around the world. I will introduce you to the key leaders in the drafting of the Constitution, talk about the creation of the World Health Organization and the exact wording of the WHO definition of health. And then I will show us a video from the family of Geraldo Souza to Seming Zhang. Here are the four people that I think had the most important roles in establishing the WHO. Thomas Perrin, who lived here in Pittsburgh and was the first dean of our School of Public Health at the University of Pittsburgh. So I know his history well, and his archives are here at the university. The next person is Dr. Seming Zhang, who was the Chinese delegate to the meetings that led to the WHO. And late in life, he also came to live here in Pittsburgh with his daughter and son-in-law in the area. And his archives were given generously to the University of Pittsburgh as well. So that's why I have a special interest in this whole process. The archives for these two men are here. I have spent time trying to find out more about Geraldo Souza, and I'll be speaking about that. And the fourth important person is Andrea Stampa, from Yugoslavia. So I'll discuss each of these people and their contributions. In preparation for this lecture, I visited archives around the world. As I said, in Pittsburgh, we have the archives for Thomas Perrin and Zheng Zhe. I visited the archives of the League of Nations and the WHO. In Zagreb, at the Stempar School of Public Health, and in Sao Paulo, the university archives there. That's where I first was able to meet Cristina by telephone, and now finally by video, someday in person too. Here is my university, the Graduate School of Public Health. The main hall was named Thomas Perrin Hall. Thomas Perrin was well known in the United States. He was the US Surgeon General from 1936 to 1948, and then he left being the Surgeon General to become the founding dean of our School of Public Health. His brief history is he was born in Maryland, went to Georgetown University, went into the Public Health Service, and worked on venereal diseases, and was involved in some of the Tuskegee studies, and because of that, there is a controversy about his role in those studies. He didn't actually do the studies, but he was Surgeon General when they happened. He became Surgeon General, and then went on to be president of the Constitutional Assembly that headed that established the World Health Organization. There is a newspaper article from the time when the UN Health Organization was started that they referred to it as the Magna Carta for Health, the Constitution, and Thomas Perrin was the president of the Constitutional Assembly. His first house here in Pittsburgh is just about 2 blocks from my house here in Pittsburgh as well. The members of the committee that wrote the Constitution of WHO are listed here. There are, but the 4 that are most important I showed in the box below, and I'll discuss them in more detail. Here is a picture of Dr. Say's daughter, Diane Way, and her husband, Maurice, and Maurice is on the telephone listening to this. I'm very pleased to have him join us. They generously donated the archives, which, and this is just one document from that collection, but there were boxes of his primary correspondence, his diaries, his letters, and they really are very revealing of the meetings that took place and even the political dynamics. So I'll discuss some of those. But again, I'm so grateful to the Way family for letting the archives come to the University of Pittsburgh. Dr. Say was born in China. His father was the ambassador first to Britain and then to the US. He got his MD degree in Cambridge, worked in China, became a member of the UN Relief and Rehabilitation Administration, became the UN Medical Director, retired to Florida, and then moved to the Pittsburgh area where he died. Picture there shows the Say family. He's the young man on the right. The creation of the World Health Organization was, here are some of the other international health organizations that existed before the WHO. The timeline is on the bottom from 1860 to 2020. There were a series of international sanitary conferences in the 1850s to 1900, at which time the Office of International, the Hygiene and Officine Nationale de Hygiene Publique was established. When the League of Nations was started, they had a health organization. And during the Second World War, there was a major organization, the United Nations Relief and Rehabilitation Administration, that handled much of the international health issues. And the Pan American Health Organization had also existed since 1902. And the WHO was basically a merger of all of these prior organizations right after the Second World War. To do that, there were a series of international conferences in 1945 and 1946. Here are the 4 conferences that were led to the creation of the World Health Organization. The first was the United Nations Conference that established the United Nations Charter, and Brazil was a leader in forming the health organization at that time, with a declaration by China and Brazil to form an international health organization. And as I said, Dr. Say and Dr. Paula Souza were critical figures. The next meeting was a resolution to convene a health conference. The most important one leading up to it was the Technical Preparatory Committee in Paris that drafted the Constitution of the World Health Organization. And then the International Health Conference 2 months later, in 1946, led to the approval of the Constitution of the World Health Organization. Here is a photograph of Dr. Souza and Dr. Zay in San Francisco at the time of the founding of the UN and the proposal to have an international health organization. These were 2 of the key figures that proposed this. It wasn't on the agenda, but it came in later in the proceedings and led to this series of meetings that I just showed. But these 2 men together became friends and were instrumental in starting the WHO. I don't need to tell the history of Dr. Geraldo Paula Souza to this group, but he did get his doctorate at Johns Hopkins, and you have that marvelous photographic collection. He had many accomplishments here in Sao Paulo, including founding of the School of Hygiene and Public Health. In the archives from Dr. Zay, there are many letters back and forth. Many of them are to Dr. Paula Souza. So here's an example of one. I show it to you just because it shows the confidence that they had in each other. I'm sending you a copy of the resolution. As we did in San Francisco, it will be necessary to lobby. I'm quite confident it will be passed unanimously. Dr. Stamper of the Yugoslavia will second the resolution. We will then propose a second resolution to the effect that the Economic and Social Council requests the U.S. government to convene the conference. Dr. Stamper is not quite so happy about the resolution because he thinks the Russians may not like it. So I got the Cuban delegate to second it. So it's an insight into the politics, of course, at that time, right after the Second World War. Dr. Stamper, who they're referring to, is in Yugoslavia. He was born in Croatia, got his medical degree in Vienna, became a health officer in Yugoslavia, established the Peasants University, became the dean of the med school at Zagreb. He was held by the Nazis for some time during the Second World War. And when he was freed, he became the dean of the School of Public Health. He became the chairman of the Interim Commission of WHO and presided over the inaugural World Health Assembly. So he is a major figure in also establishing the WHO. But the politics of his association with the Russians made these negotiations awkward. Here is another letter from Dr. Zhai, this one to a colleague of his in China, that he says, Dr. Stampar could have been of mutual assistance because he had been selected the vice president of the Economic and Social Council, and he could have used that prestige of that position to facilitate our proposals, but unfortunately, he allowed himself to be guided purely by political motives in bowing to Russian wishes on every occasion. So there was a tension between the Say and Paula Souza and Perrin, both Say and Paula Souza had strong U.S. connections in Paula Souza's case because of his training in Johns Hopkins. So in another note, Dr. Say writes, the important point is to humor Dr. Stampar and not antagonize him. So that's the background, but the actual crafting of the WHO definition of health is what I want to focus a bit of time on. The definition was first written in the Technical Preparatory Committee minutes from the official records. Here are the members of that, the subcommittees. Dr. Say chaired the subcommittee on the preamble, Dr. Paula Souza chaired Committee 7, the subcommittee on the study of the agenda for the International Health Conference, and many of the members participated in one or two of the subcommittees in preparing the constitution of the WHO. Here is a photograph of the Technical Preparatory Committee in Paris in 1946. It met almost exactly the time of my birthday. I was born just a few days before this conference was held. And you can see the key members there are Paula Souza, Say, Stampar, and Perrin. And I think it's no coincidence that Say and Paula Souza are sitting next to each other. Another note about the background is that in setting up who would be the chair of the Technical Preparatory Committee, before the meeting, there were the usual consultations about the chairmanship, and that Jameson, who is a personal friend of Stampar, handled Stampar and secured his agreement to the appointment of Sand, that's Renee Sand from Belgium. Perrin also then handled the Cavillon and in order to save French face, he agreed that Perrin would propose him as the chair, but that Cavillon would decline. So that they set up in advance who would be the chair, and it would be the English-speaking chairman, Renee Sand from Belgium. So at the conference, there were 4 separate constitutions that were considered, one from the UK, one from the US, one from France, and one from Yugoslavia. And the challenge was taking these 4 different draft documents and putting them together, taking the best of each and putting them together into a final document for the constitution of the WHO. In his autobiography, Dr. Seming Zay writes that unfortunately, Stampar was delayed for some days in arrival in Paris from Yugoslavia, spending those days in a stalled railway coach en route, as communications in that part of Europe were still disrupted after World War II. He arrived in foul temper to find Dr. Renee Sand of Belgium had already been chosen chairman, a post he had expected to fill himself. I wonder, and I could not find any documentation, whether or not it was an accident that there was a stalled railway coach en route, or whether or not someone had orchestrated the possibility that Stampar would be delayed so that he was not there at the beginning. But that's just speculation on my part. When he arrived, he submitted a memorandum Dr. Say felt that his views on the draft constitution were not very helpful, but instead the committee accepted virtually the whole of the draft constitution by Dr. Perrin and his U.S. Public Health Service colleagues. For the WHO preamble, though, there was in some ways, I think, a deal was cut, is that the only part of the Stampar's draft constitution that they used was the part that related to the preamble. So they took large parts of Stampar's preamble, but not the substance of the Constitution. And one of the important elements of the preamble that Stampar submitted was a definition of health. And here is his first written definition of health. Whereas health is not only the absence of infirmity and disease, but also a state of physical and mental well-being and fitness resulting from positive factors such as adequate feeding, housing, and training. Of course, that's very similar to what ended up in the current definition of health, but it was modified. But this is a very modern, very socially aware definition of health, and I'm impressed that they were able to put the good definition together. Well, after Stampar submitted his draft, the subcommittee that Dr. Say chaired took and revised that and shortened it substantially. Health is not only the absence of infirmity or disease, but also a state of physical fitness and mental and social well-being. Then when it went to the final technical preparatory version, health is a state of physical fitness and of mental and social well-being, not only the absence of infirmity and disease. And the final version, which was adopted in New York, is the current definition, which has been unchanged now for 75 years. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Here, when I visited the Stampar School of Public Health in Zagreb, of course, they're very proud of the fact that Dr. Stampar submitted the first version of this definition. And so here is Dr. Bosakov, the Dean of the School of Public Health, standing by the words in Croatian. So where did Stampar get the idea for this? Well, I think it's fair to say that he was inspired and helped by two of the senior figures from the League of Nations, Raymond Gautier and Yves Biraud. Yves Biraud was the head of epidemiology from the League of Nations, and Raymond Gautier was the director of the health organizations for the League of Nations, both of whom were influential in health before the start of the World Health Organization. The letter that written by Biraud, he says that he worked with Stampar, and he says that Stampar, the Yugoslav delegate, 2 days after my arrival, asked me to help him during the session of the council to deal with health matters. He had in hand the draft constitution of the health organization prepared by Dr. Gautier and myself, which Dr. Gautier had given him. We had many conversations regarding this work. He wanted me to act as secretary of the expert group. Together we drafted a resolution. So in his letter here, Dr. Biraud says that he drafted the constitution and gave it to Stampar, and that was the version that Stampar presented in Paris to the technical preparatory committee. And Gautier, in one of his earlier notes, notice the date is 1943, said that in the final sentence there, this promotion of health for all, which means something quite different than the mere absence of disease. So he was already using phrasing that ended up in the definition of health. So where did they get the wording? Well, these exact phrases had been in the socially conscious medical literature for some time. For instance, as early as 1916, In the minutes of the board of the apportionment for the city of New York, they refer to as health is more than absence of disease. It's something positive. Involves physic and vitality and mental as well as physical. This was 30 years before the WHO definition. This was by George Whipple, the professor of sanitary engineering. In Canada, not too long afterwards, our definition of health, the condition of well-being, not mere freedom from obvious disease. And that the very famous public health expert Henry Sigrist, in a lecture in 1940, said health is therefore not simply the absence of disease, it's something positive, joyful, and a cheerful acceptance of the responsibilities that life puts on the individual. So there are already several definitions that were quite similar to what ended up in the WHO definition. So the wording itself for the WHO definition started with these emerging concepts around positive aspects of health, with Gautier and Barra from the League of Nations and their draft that they gave to Stampar, who then, on a delayed train, got to Paris and presented it. His constitution wasn't accepted, but his preamble was. The preamble was modified and put into a formal phrasing by Dr. Say and his team on the subcommittee for the technical preparatory committee, and then Thomas Perrin was the person who finally led the group that approved the final definition. So the WHO definition of 1946 was a broad, modern definition that emphasized mental and social determinants of health. That this definition had its roots in the European socially aware positive concept of health, as put forward by the League of Nations and Andreas Stampar. And the key international figures who led to the creation of WHO were Perrin of the US, Say of China, Paula Souza of Brazil, and Stampar of Yugoslavia. And it was my good fortune that both Perrin and Say later moved to Pittsburgh, and both lived there in their final days here in our city, and so their archives are here in Pittsburgh. These are both rich resources for understanding the emergence of the WHO, and that Say and Paula Souza were close friends and confidants and remained so, as best as I can tell, for years thereafter. So let me say thank you to many people in the US, in Switzerland, Germany, France, Croatia. This has been a wonderful adventure for me to try to put together some of this history. And I hope that it's illustrated to you where our current modern definition came from. And thanks to Dr. Cristina Campos for inviting me to give this presentation. Now I would like to spend just a minute here and show this movie. Are you there with me still?
Yes, Professor. You're here.
Okay, good. So here is the video. So years later, Dr. Say wrote a letter to the Paula Souza family and suggested that they make a museum of the World Health Organization by taking their collection archives and putting them together so that people could have them in one place. And this was in 1988. So the family of Geraldo Paula Souza sent a video back to him with the materials that they have. And it's a 15-minute video, and I will just show a few minutes of this video letter that was sent from the family of Paula Souza to Dr. Saiming Zay.
Hello, Dr. Z. As you see, we have lots of books about my grandfather, Dr. Geraldo, Paula Souza. And here's my mother, Ada. I don't know whether you met her. Yeah. But here she is. Say hello to Dr. Z, mother.
Hello, Dr. Z.
Only that?
Oh, I wish I could see you and talk to you, but it's very far away.
Good.
We have lots of things, but in Portuguese. All the appointments and everything, I don't know if that interesting.
We also have films about the World Health Organization that may interest you and your project. We'll be glad to send you everything. We really like the idea of making the museum.
What? Geraldo.
Personal things of Dr. Geraldo are all kept by his daughter Ada and his wife, Evangelina, as you remember. Where is she? She lives alone, she's 90 years old, and she keeps all the swords Dr. Geraldo loved so much, and his personal objects also. The Chinese objects he loved, all his swords. And here's his wife, his widow. Olá, vovó.
Aqui, tá bom? Tá bonito hoje como nunca.
Olá, hello, Dr. Z.
How are you? How are you? Vai lá, Franco. Ficou gravado? Tá, deixa de molecada.
Fala alguma coisa em inglês pro Dr. Z.
Goodbye, how are you?
Long time no see.
Long time.
Okay, here she is.
Bye. Bye-bye.
Well, you get the idea. There's a long video and it shows additional materials that they have. So let's see if I can get. Okay, and I will stop presenting, and I think I'm back to everybody. So, well, thank you. I hope that gives you an idea of the materials and an introduction to the definition of the World Health Organization definition of health. So, thank you. I'll be glad to answer any questions.
Thank you, Professor Bart, for your wonderful lecture. And now, Michelle, do we have any question on YouTube, or now we open to the other colleagues to make some questions and that to Professor Bart about the discussion that he had in his lecture.
So until now, we don't have any questions. I also would like to reinform that the attendance list is on the chat on YouTube. So please fill the form to get your certificate. We have some comments about congratulating the works, the presentations. I think that's it for now. So we can, you can go and make some questions from here if anyone from here has any questions,
Professora Maria Gabriela, please.
Thank you, Jefferson. Congratulations, Mr. Burke, about your presentation. I don't understand my English, so I try. How many people interested in the history of medicine and medical institutions in Pittsburgh? Because I don't that history, medical history, and the other issues is frequently in American university, but I don't know about your university. What kind of interest that is that institution accord?
Yeah.
So.
So we do have a few faculty who are interested in medical history. We have a historical society that meets every other month and has a dinner and a speaker. We don't have a major program in medical history. And I have to say, most of this has happened mostly by chance. It is a chance that I'm the dean of the school, and Thomas Perrin was the dean of the school, and so I was interested. And because of that, I knew the history. And then when I met Diane Way and Maurice Way, who were the daughter and the son of Seming Zay, I was able to ask them questions and found out that they had the archives. So it really was not an institutional effort that brought this together. It was a series of happy coincidences. So at the same time, then when I went to Sao Paulo, I was with Ernesto here. He was working at Fiocruz in Recife, and we stopped in Sao Paulo where he has family, and so we went to the university archives there, and we asked people there about Geraldo Souza, and that's how I met Cristina by telephone at that time. So yeah, I wish I could say this was really organized. There was no organization whatsoever.
I have problem with my notebook, but thank you for it.
Okay, thank you for the question. I will take the opportunity to say that this is I'm glad that Cristina invited me to do this, because I really do think that there is an important history to be pulled together, and the archives are in different places, and you're now starting to organize the archives of the personal collection for Dr. Geraldo Paula Souza, and these other archives, and now electronically we can put them together.
Yes. So
previously, Dr. Say wanted to have a museum of the WHO. I still think we should have a museum of the WHO. But now we can have it be, a good part of this will be virtual, where people can see the documents and to study the documents. But that will require some organization. And so it would be worthwhile a discussion with the other groups in Croatia and in the US and in Geneva to see if there was some way to put these together in a more coherent way. I have talked to several professional historians. I am not a professional historian. And maybe we can get them interested. Maybe we can get a group of historians interested in this. It would require some funding. It would require some organization. It would some leadership. But I would love to see this history be preserved, because as was said earlier, this is, to me, the WHO is not just an organization. It is a concept. It is an ideal. It is an aspiration. It is what I devote my life to. And when President Trump said he was pulling out of the World Health Organization, I and my friends were beyond furious, because it was like, an attack on everything I believe in. And so so now is a good time to bring this back together and to say, let's look, about how this organization got together and the people who had the vision to put it together and had the vision to have such a remarkable definition of health, which is even better now than it was 75 years ago.
Question.
Question for you. I wrote down, I see that the origin of the concept started very early and evolved and became to the WHO. But how you see the institution evolved over these 75 years or so? If it's still in the cutting edge of health and promotion of health, what could be done to keep on the forefront in terms of vision of health?
My friend Ernesto, vision of a difficult question. Over the history, the WHO has been very politicized. It is not only at the beginning where there are the differences between the Russians and the United States, but over the years, the differences between major powers have always made it difficult to really take on major activities. The one area that WHO has been and the international community has been spectacularly successful is in vaccines. So that the original, that started with the eradication of smallpox, then that led to the expanded program on immunization vaccines for measles and pertussis. UNICEF's and Rockefellers and more recently Gates and Gavi. But the international spirit that we can make a difference, I think is strong. The politics have not stopped that. The most interesting stories were in the efforts to develop the polio vaccine, the Stamen polio vaccine. Then the vaccines were tested in the United States and manufactured in Italy and tested in Russia at the height of the Cold War. So you can work health. You can often work through health to make things happen that are difficult. The WHO is not a strong organization. None of the politics let it be strong, but it is still, I think, an inspiration and an aspiration.
Thank you, Don.
Well, I hope you all enjoyed the video clip of the family of Geraldo Paula Souza. I think that is precious to see his wife and daughter and grandson, and I wish we had more. And I don't know what's on all of. Do you have those films, Cristina? Do you have all of the films that were shown there?
No, Professor. You give me a copy. I don't know the video.
I meant in the video, on the tabletop, there were lots of films that were stacked up. Do you have those films?
Yes, I have, Professor, but I don't know how is the movies. I don't know if we can use it. It's too many changes, and we need a specialist to see the material.
Yeah, well, hopefully those could be digitized also. Yeah.
Professor Burke, I got a question for you. If you can I ask, Cristina?
Yes, Jefferson.
I would like to know or listen and hear for you about how important was the beginning of the Cold War to for the formation of the World Health Organization. If the struggles, if the contesting about between USA and Soviet Union would have some influence or on the definition of the politics on WHO.
Yeah. So it is important to remember that WHO was started even before the end of the World War II. So, and I have read some of Thomas Perrin's writings, and Thomas Perrin writes about the devastation of the Second World War and the horror of the war, and particularly the nuclear weapons that were first used. And I think part of the reason that people wanted to have a positive definition of health, including mental and social well-being, was this realization that the health of the world was not just about diseases, but the war and the potential for destruction, and so the importance of the positive social dimensions. So in some ways, the war did help set the definitions, for making it easier for people to accept these positive mental health and physical and social health. Then the reality set in with the Cold War, and it made it difficult to get things done. But even in the area of health, like I say, that in the smallpox eradication, the Russians and the Americans worked together at the height of the Cold War. So health was able, people were able to work through health, so to a surprising degree. But it made it harder. It kept, for the most part, I think that it kept WHO weaker than it could have been, because nobody wanted WHO to be too strong, but everybody wanted to have some control over it. But that first that WHO grew out of the Second World War is an important reminder.
Cristina, vou fazer uma consulta e depois a Michelle, o Jefferson translate, né?
Ok.
Né? Cristina, o material que você levantou nesse projeto, ele é basicamente do início, né? Do Johns Hopkins, da presidente do Johns Hopkins. Você teve acesso pela donada de um material mais e prossegue, né? Que não fica só nesse período. Quanto da Organização Mundial da Saúde você já identificou no material?
Gabriela, I try to...
Professor Burke, I need that Michelle or Jefferson translate please, for Mr. Donald. It's about documentation, archive of Cristina, that about the organization of the age code.
Let me say, I should be the one to apologize. Here I am speaking to an audience in Brazil, and I'm speaking in English, so I don't know. So I apologize.
No problem, Professor. No problem.
No problems. The problem is mine. My English is very bad.
Professor, it's very difficult to us to speak English, but we are so happy to be here with you, you with us, and we want to talk a lot about this project. You are a very special guest, a colleague, and we are together, Professor. Gabriela, about the material of World Health Organization, this part of the material was with André Mota, Professor André Mota, in the museum, in the Faculdade de Medicina, University of São Paulo. The material was with André Mota.
Mas ainda não foi trabalhado, ainda não foi processado.
No, I need to process with Gustavo. We should work together to organize the material. I think in the Public Health College with Cristina Marques have some material there too. We need to see, né? Me, you, André, Cristina, to see the material.
Maria Cristina Marques, Mr. Brook, is now director of the Memory Center, right? Did you know, huh?
Yes, I know. She's a very important player for us too. We need to talk. Well, Jefferson, I think we can finish this first day, okay? And I just want to say thank you to Professor Donald Burke. We keep in touch, Professor, and say hello to my colleague, Professor Ernesto Marques. Hi, Ernesto. Thank you very much. Thank you, Professor Donald. We talk a lot. Okay, thank you very much.
And let me also say thank you and goodbye to Mr. Wei, who's on the phone still.
Okay, Mr. Wei, thank you. Thank you to participate of this event, Symposium, okay? Thank you very much.
Okay. Bye, everybody.
Thank you, everyone. Bye.
Bye. Cristina, você ainda fica por aí um pouquinho, que eu queria falar com você um instante.
Um momentinho, Gabriela, eu estou aqui, só estou interrompendo a gravação e eu gostaria de estar finalizando o primeiro dia, tá? E estou interrompendo aqui a gravação no YouTube. Então, um abraço a todos. Obrigado, Jefferson. Obrigado, Michele. Eneida e professor Vasques, professora Gabriela, amanhã nós temos o dia 2 do evento. Muito obrigado, gente, encerrando agora o primeiro dia aqui no YouTube. Obrigada, até mais.